Hi everyone, welcome to my research presentation on leadership tactics reducing burnout in nurses among the COVID-19 pandemic. As we all know, burnout has been a progressive fault in the healthcare system which has only been exacerbated by the crisis of the COVID-19 pandemic. Leaders within the nursing field have been pressed under constant changes relating to lack of resources, increased patient populations, high patient acuity, and increased fear and anxiety surrounding the uncertainty of the pandemic itself. The purpose of this research is to explore and evaluate the leadership tactics that we can use to reduce burnout among staff during a period of crisis and focus on bringing a more uplifting workplace environment in totality. Burnout in relation to nurses can be defined as a widespread phenomenon characterized by a reduction in nurses' energy that manifests in emotional exhaustion, lack of motivation, and feelings of frustration that may lead to reductions in work efficacy. The effect of burnout can also unfortunately be a factor in decreasing patient satisfaction and an increased turnover rate of employment for nurses. Within the review of literature, it is found that methods of research used to collect data concerning burnout analysis and leadership roles that affect it include personal self-reporting methods, the perceived stress scale, leader empowering behavior scales, and Maslach's burnout inventory, as well as individual nurse manager interviews. The perceived stress test collects information by giving a subject, so whomever is taking the stress test, different situations to retrieve answers based upon how they're feeling and the emotions that classify their perceived stressors. The Leader Empowering Behavior Scale helps organize records of behaviors involving enhancement of meaningfulness of work, expressing confidence in employees' performance, and fostering opportunity to participate in decision-making. The Maslach Burnout Inventory assesses and scales employee emotional exhaustion, depersonalization, and personal accomplishment within the workforce. Among the qualitative data collected, interventions that remain successful when implemented by leaders among nurses, such as through managers, supervisors, and even charge nurses, included providing staff nurses opportunities for voicing opinions, ideas, and concerns that help alter the decision-making process, along with broadcasting to promote nurses to express autonomy and facilitating goal setting among the staff. This is coupled with highlighting of incentive pay, such as bonuses. Leaders also found more success in aiding the nurses' psychological health by creating safe spaces to express empathy and improve manners of respect for their staff. Finally, proactive management helped nurses feel as though they were a part of a team, having a leader to create future plans and accommodate different outcomes allowed for the nurses to feel less anxious about day-to-day changes within crisis periods. Overall, these interventions allow for greater success in retaining nursing staff and providing a well-rounded environment among the pandemic. Leadership that fosters positivity and democratic thinking are effective tactics that can be used to prevent burnout and its progression to cultivate a much healthier work environment for leaders and colleagues. Thank you for listening. Again, my name is Leah Fitzgerald from Worcester State University. And I hope you're able to take away some of these leadership tactics in the future to help burnout in any circumstance among employees or other colleagues.